So right now on the screen, you will see our logo, and I'm going to open up the OtoSim 2 software, which is in your applications folder at the bottom. OtoSim 2, click, and this is our splash screen. And we'll go over fairly detailed this program to show you some of the features that are different from our previous version, and also explain some of the importance of our newest additions. Okay, so then holding the ear, we go through some very basic stuff first. The first part of this program is designed basically to be used as an instruction of some basic understanding of otoscopy without the use of the simulator. As we get further into the program, if you go in order, we will see that we start introducing the simulation part of the package, and becomes quite obvious in what we're trying to accomplish. But we go through it one section at a time. If you go through it from the beginning, you will get a good understanding of some of the basic anatomy and characteristics of performing the otoscopy examination. So the next section here you see is holding the ear. So in this section we just simply show you how you straighten the ear canal on the patient, an adult, to perform the otoscopic examination. How to hold the otoscope. It is very important for the instrumented otoscope used in OtoSim 2 that the otoscope be held in a vertical position, because of the ability to navigate the screen with our technology necessitates the otoscope to be held in the vertical position. Some users prefer to use a pencil approach. That is fine for looking at static images, but when it comes to the interactive segments of the simulation package, the otoscope has to be held in this vertical position for it to be effective in our program. Ear anatomy. So in this section, we actually show you a coronal view of the ear, and we again review some of the basic anatomy that's required in understanding of the otoscopic examination. And whenever a chart appears within the program side menu, it could be a 2-column chart or a 3-column chart. Whatever the top of the column is activated, it'll turn green. So in this particular situation, the first column is green. So the show, which is the what's being shown on the main screen, is on. And if you look at the anatomical structure we're trying to show you, in this case it says pinna, you will see on the main screen that the pinna is boxed in with the highlighted area. And as I move to the different areas of anatomy, for example the external auditory canal, you can see that the external auditory canal is now highlighted in a box, and so on. So you go through the anatomy of the coronal section of the ear. And as you become very familiar with these, by learning it on the main screen, then you can check your knowledge by turning the screen automated function on. So you'll see now it's now pointing, it's telling us to point to the external auditory canal. So again, with our mouse, if we go to the external auditory canal and we click on the structure, you'll see that it now defines it as being correct. And it proceeds to the next anatomical structure automatically. In this case, now it's going to the cartilaginous external auditory canal. So if I go to the model and point to the external auditory canal, you'll now see that it's now accurately identified that structure. Then it goes to the next, bony external auditory canal, and you'll see, and etc. So it goes through the entire package and giving you a very good basic understanding of the cross-sectional gross anatomy of the ear. And when we're done that section, we simply go to the done section and get out and back to the main screen. So now we're going to give you some more ear anatomy in a canal view. So now we have, in this particular part of the program, we now have a picture of the actual tympanic membrane as seen when looking down an otoscope. And in this particular section, what we actually do is we're trying to give you an impression that there's more to the ear than just examining the eardrum. Obviously, otoscopy is a very thorough, complicated procedure or technique which should be practiced in its fullest. So you must also understand and appreciate the anatomy of the middle ear and of the temporal bone when you're actually looking at the eardrum. So in this case, this is what the eardrum looks like. But if we go to the next slide, what we do in this case is we anatomically peel off the eardrum and we show you the middle ear structures, which we'll get into more detail in the following sections of the program as well. But it gives you an idea of what the things are in the middle ear that we actually should be trying to view through a translucent normal tympanic membrane. And then if we do it again by pushing the next button, we now peel away the temporal bone basically, and allowing a translucent 3D impression of the inner ear structures, which are again related to where the tympanic membrane was. And at any time, if I want to go back, I can go back to the previous one and just put the eardrum, take the eardrum away, and then I can put the eardrum back on. So I can toggle back and forth if I would like, in order to, again, get very familiar with the structures that we're going to be seeing through the eardrum, trying to visualize through the eardrum. And we're going to stress this quite aggressively in the main body of the program, which we'll discuss in a few minutes. So when we're done that, we simply press out. We're back to the main screen, and then we have the final section in the introduction, being the OtoSim phone and tablet applications, which you can get and purchase online. Okay, the next thing we actually check in the program is the person's ability, the user's ability. Do they have the skills necessary to perform an adequate otoscopic examination? So in this section, as there was in OtoSim 1, it's very important that we check certain parameters of somebody's vision before they actually start learning otoscopy. So the most important one is obviously acuity. So now with the acuity, a Snellen's chart comes up, and this image is actually translated to the simulator. So in this particular situation, when the user looks down with the otoscope into OtoSim, the base unit, you will now see a Snellen's chart in front of you, and you should be able to read down a significant number of these letters down to, probably the sixth row. If anything less than that, you will probably have to see an ophthalmologist or an optometrist and check your visual acuity and need correction. So we check that as an initial outlay. And then, color is very important. So in this particular one, when you look at the main screen, you will see, if you are not red-green colorblind, you should see the number 74 on the main screen. The same applies when you look down OtoSim, you should be seeing the number 74. If you cannot see the number, then you may have a red-green colorblind defect of vision. Now we're going to get into some of the simulation-based parts of the program. And the most important part of using the simulator now is using the instrument. So for OtoSim 2, you are supplied with an instrumented otoscope, which is connected to the computer. And in order for us to use this properly, you have to be able to use the instrument correctly. So we go through a short exercise on how to use the instrumented otoscope. So when I open up that menu, you'll see I have 4 skill levels. If we select the first skill level, the first thing you will see on your screen is that you'll see an eardrum with some circles on it. You'll have a green mark, or hatch mark, which we'll show you here in a minute. And you'll have a red dotted line, which tells you have to navigate in the OtoSim simulator to get the crosshairs to this position within the circle. And you have to hover within that circle for 3 seconds. There'll be a countdown, and then a new dashed line will appear. But the first thing we want to stress is that we have to calibrate the instrument. So we go up to the top bar again into our tools section, and to calibrate the instrument, there's a diagram that shows you how to position the otoscope on the OtoSim platform, and we make sure that it's in the right position, and then you hit the calibrate button, and the calibration is completed, and you'll see what would have happened here, that now you have the crosshairs on the main screen and also within OtoSim, which now are telling you that you must navigate the scope into this position here. So I will show you that how it's done. So now with the otoscope, you actually put it into the ear, and I just go up and down with the otoscope, or left to right, and I navigate the dot inside. Inside, you'll see there'll be a countdown, and then the clock starts, and then another one appears, a countdown, stay inside for 3 seconds, then the next one appears. And this allows us to practice, again, the instrumented scope, which will become very important in identification of anatomy later on when we do get into the main bulk of the pathology sections. And once I'm complete of all the sections, you'll see that the time stops. It gives us an idea. We can compare one student to the other and how good we are at the scope, or we can compare it to ourselves as we improve our technique. Now we're going to go into some of the otoscopic findings. Everything so far has been fairly basic. Okay, so the first thing we're going to show you is normal landmarks. Okay, so what will appear on the main screen now is a picture of the eardrum. This is also reflected in, this image is also shown in the OtoSim simulator. But what is not shown in the OtoSim simulator is actually the actual structure that we're trying to identify. In this particular situation, if you look at the top right of the screen, it is saying the primary light reflex. So the primary light reflex is shown on the main screen, but it is not shown in the OtoSim base unit, and the user has to now navigate the otoscope hash marks to get down into the light reflex. And as soon as I hit it correctly, you'll see what happens. The eardrum peels away, and showing again the structures of the middle ear and the inner ear, both on the main screen as well as in the simulator, again for nailing down that structure in its position within the temporal bone. And then you can go to the different structures. The umbo. So the umbo is shown here. So again, within the simulator, I go down and point to the umbo, and then the eardrum peels away. The circle remains, and it shows you the position of the umbo with relationship to the middle ear and inner ear structures. And we go down the list, again showing the anatomy. And there's also writing down below, some literature on each of these structures, very basic, to let the user know what they're actually looking at. Now you'll see that we start from the external auditory canal. We navigate to the middle ear, and we go in a stepwise fashion with all the different conditions that can affect the ear, and including a high-end specialist otology section with tympanic membrane retraction. So we'll just start with this again. There's a lot of repetition within OtoSim 2, and that's how we feel that is the best form of learning. So there's repetition throughout the entire program, which is always a benefit to learning. So in the introduction section now, we will repeat some of the things that we learned in the first part with respect to our anatomical knowledge. And you'll see again when these two charts appear that we now can identify the structures both on the main screen, as this first picture is not to be used in the simulator, but again to review some of the relevant anatomy, is the teaching ability of an instructor to the student. So I can actually annotate certain structures. If I use a circle, I can annotate a circle. I can use a square. I can annotate something with a square. I can erase them, and I can produce a magnification of what I'm trying to look at by the magnification button. We're back to the main screen. We didn't do everything, so it didn't light up in red. And then we go through all the different sections of different pathologies. So if we go, for example, we'll take an example, osteoma. There's a picture of an osteoma. There's lots of examples on the top. A picture of an osteoma. This is down the simulator as well. And there's many examples. In the next example, you go up to the top right of the screen, and you get page 2. And it gives you some pathology and some other instructional material as well. And then, as I mentioned, if on any of the examples that we're choosing here, there is a screen that shows up. In this case, there's now a 3-part screen. this allows the student to practice, again, identification of landmarks. So in this case, the main screen is on, so the umbo is shown here, and the short process of the malleus, the light reflex, the osteoma of the ear canal, and the inferior tympanic annulus. And if I wanted to practice that on the screen, I see the umbo. I look for the umbo. The umbo is right here. I click on it. It appears, and I get a check mark. Short process of malleus. Again, correct. The light reflex. The osteoma. And the inferior tympanic annulus. Okay, and then if I turn the simulator on, now I have to do this within the simulator. And if I don't want to cheat, so to speak, I can turn the main screen off, and just by the simulation on the chart here, this will automatically sort through these as I hit them correctly on the simulator. But for this case, I'm going to turn it back on. So if I get to the simulator and it's asking me for the inferior tympanic annulus, if I point to the inferior tympanic annulus, it now clicks it, and then it'll pop up to the umbo. And then to the short process of the malleus. And down the simulator, you won't see the circle as you do now. You'll only see it when it appears. The light reflex and the osteoma. Okay, and then we're done that. And you carry on. So there's lots of content. As I mentioned, external auditory canal, middle ear, and then specialist otoscopy. One of the other things that I didn't really talk about yet in the program is the ability to teach with our annotation toolbar at the bottom of every screen. So in this particular situation, I have a normal eardrum, for example. If I want to, as an instructor, I want them to point to something, I can annotate it with a circle. So if that's the umbo, here's the short process. Here's the incus, etc. I can clear the screen. I can magnify certain structures, as I pointed out earlier, for the students to get a clearer vision of what we're actually trying to teach. Okay, so we're done that section. And let's go on to the next section, which is pneumatic otoscopy. Now, with pneumatic otoscopy, there are two options here. With the OtoSim 2, you will get the top contents, the screen-based content. You will not get the practicing simulation version unless you buy the PneumaticSim attachment for the OtoSim unit. So you will get this first part, but we'll give you an example. For a normal ear, for example, this is what the program would look like. So in this case, you will see a video of pneumatic otoscopy on a normal eardrum with a bit of explanation given to the side. Okay, but if you have the PneumaticSim attachment, when I click on this, you will now get a different looking screen. You will see the normal eardrum in the main screen. You will see a pressure graph on the top of the screen with the pressure generated by the pneumatic otoscope, from the top being kilopascals and the bottom being in inches of water. And you'll see a bar in the middle of it. And if I have a pneumatic otoscope with the pneumatic attachment, what I can do is use the pneumatic otoscope to seal the ear and generate pressures for pneumatic otoscopy. And I actually can watch the eardrum move in and out with changes in pressure. And you can see on the top graph, the maximum pressures are actually stored by those two black bars on each side. So if I increase the pressure, for example, I can push the pressure into the red, which we don't want to do, obviously. It'll show me as a student how how much pressure I've generated on the positive side, and then I can clear the bars again, start fresh. What we've added in OtoSim 2 are two very important functions, we believe: the self-examination portion and the anatomical quiz section. In the self-examination, we have a bank of over 250 questions, and we have a standard quiz and a comprehensive quiz. We'll just give you an example of a standard quiz. So if I click on the standard quiz, this is what we see. And going through the screen here, we'll see the number of questions. In this case is 20. And we have the ability to turn the main screen off and on, as we've had all along. We have a start button for the quiz. And as soon as I press this, a timer will start, and I can shut the timer off by pressing the button below, which we'll see in a minute. And as soon as I start the quiz, there will be a question given up in the top box, and then the multiple choice answers, which can be selected by the student in the bottom of this right part of the screen. So let's start the quiz and the first question. So what you'll see is a 3-year-old. I'll read the question. 3-year-old has a 24-hour history of otology and fever. The child has also had an upper respiratory tract infection for the past week with a sore throat and cough. Otoscopic findings most closely support the otologic diagnosis of. And so I get certain choices down here. And in this particular situation, the main screen is actually showing me what is being displayed in the OtoSim simulator. But if I didn't want to cheat, so to speak, and make the image bigger, I can shut off the screen, and now it would force me to look down the simulator in order to look at that image, which I just showed you on the main screen, and then I would select my answers based on what I think is the correct answer. And this is a self-test, so it allows me to make selections which could be correct or incorrect. So if I say, for example, that was a perforation of the eardrum, it tells me the answer is wrong. I can select again. Is it tympanosclerosis? No. Is it otitis media with effusion? No. Is it acute otitis media? Yes. Okay, congratulations. So we'll turn the screen back on, and then I can submit that, and that now goes out of the examination, but I don't want to go out yet. I want to do the next question. And then we go to the final section, which is the anatomy examination. Okay, in the anatomy examination question part of this program, we have two sections. One is without using the simulator, just practicing with the on-screen mouse. So if you don't own an instrumented scope, but you do own an OtoSim base, you can practice your anatomy by the on-screen mouse version on the bottom. But if you do have the OtoSim instrumented otoscope along with the base, then you can actually practice both on a normal tympanic membrane landmarks as well as pathological feature identification with lots of different structures being asked to identify. So let's, for example, choose the normal or the tympanic membrane landmarks on a normal eardrum. Again, we get this visual that comes up. We start the quiz. In this case, now it's asking us to locate the following landmarks. The light reflex. So as you notice, the light reflex is shown on the main screen here, but not in the simulator, and the time is running. So if I run out of time, you'll hear it gives me the buzzer. Okay, but we're not trying to make you nervous in this part of the examination. But if you go back in the simulator and you identify it correctly, you hover inside for the time. You see now that it's turned green, so I've actually identified it correctly. Okay, but let's do the next question. So this is asking me locate the vascular strip. So on the simulator, I go in and locate the vascular strip. And there, congratulations, you found it. The box turns green, etc. And I can start the timer or stop the timer at that lib. So that basically concludes the software review of OtoSim 2. And as you probably have noticed, we've added many features, which we've just skimmed the surface on this brief discussion. And we encourage the user to start at the beginning, work towards the end, and by the end, you should be a much more solid practitioner, whether you're providing primary health care from a nursing perspective, from a residency perspective, or from even a specialty perspective. So we hope you enjoy the simulator and can learn lots from it.